This is lesson 17, and we're going to be talking about prescriptive authority, primarily about controlled substances, and we'll be covering pages 87 through 90 in your book. So, who can prescribe controlled substances is actually determined by state law. Every state has different rules on this, and when a state decides who can prescribe controlled substances or who can possess or administer controlled substances, then DEA will issue DEA registrations to those individuals. Florida law authorizes the following types of practitioners with the authority to prescribe controlled substances. And this is pretty typical of most states. Medical doctors, osteopathic physicians, dentists, podiatrists, veterinarians, and certified optometrists, but they have a very limited formulary of controlled substances they can prescribe. You can see there it only includes tramadol and Tylenol with codeine number 3. But all of these practitioners have what I call independent authority to prescribe controlled substances. So they are prescribing under their own license versus the physician assistants and nurse practitioners, if you turn over to page 88, have what I like to call dependent authority, because they're prescribing with a supervising physician that's ultimately responsible for their actions. So let's look at the physician assistants and nurse practitioners. Oh, before we do that, the study tip on the top of page 88. There are other healthcare practitioners that are licensed by the Department of Health in Florida, such as naturopaths and chiropractors, but these types of practitioners do not have any prescriptive authority, much less for controlled substances. So don't let them trick you into trying to think that these other types of practitioners can write prescriptions as well. Now, there are some restrictions on the prescribing of controlled substances for these mid-level practitioners, these physician assistants and advanced practice registered nurses. They're pretty much the same in letter G and letter H for the advanced practice nurses and the physician assistants. You can see the restrictions there. First of all, the authority's got to be delegated by the supervising physician. And for Schedule II controlled substances, while they can prescribe these products, they are limited to a 7-day supply. Remember, the 7-day supply only applies to physician assistants and advanced practice registered nurses, not to physicians or dentists or people that have independent authority. Both PAs and advanced practice registered nurses are not allowed to prescribe controlled substances in a pain management clinic. That goes back to some issues. Florida had more pain management clinics, I think, than any state in the country. There was a big problem with illegitimate pain management clinics and during the opioid crisis. So they pretty much just put a flat-out prohibition against nurse practitioners or PAs prescribing in a pain management clinic. So they would have to do this in an actual physician's office or a hospital or a clinic type of setting, but not a pain management clinic. There also is a restriction for both PAs and advanced practice registered nurses that says they cannot prescribe controlled substances or psychiatric mental health controlled substances for children younger than the age of 18. So that's a really good one, because they could throw a question at you with a particular drug, and you have to say, okay, not only is this a controlled substance, but it's a psychiatric mental health controlled substance. So you have to use your clinical knowledge there. And it can't be for a child younger than the age 18. There's one exception to that, which we'll cover in just a moment. There are some additional restrictions on controlled substance prescribing for acute pain, but we're not going to cover those now because they apply to all prescribers, not just the physician assistants and advanced practice registered nurses. And by the way, the advanced practice registered nurses is a term that encompasses a group of advanced practice nurses, and some of those are listed for you in the note under letter H on page 88. It includes certified registered nurse anesthetists, nurse practitioners, clinical nurse specialists, psychiatric nurses, and also certified nurse midwives. All of these are considered advanced practice registered nurses. So there are some special rules for psychiatric nurses, a subset of the advanced practice registered nurses. They are allowed to prescribe psychiatric controlled substances to children under the age of 18. And also they are not subject to that Schedule II 7-day limitation if it's for a psychiatric Schedule II medication. And you'll see the note I have under I-2 on page 89. That kind of makes sense, particularly if they're treating someone under the age of 18 that has ADHD with methylphenidate or something like that. They should be able to prescribe more than a 7-day supply. Okay, let's talk next on page 89 about out-of-state prescribers and whether or not they can write controlled substance prescriptions. The Florida Controlled Substance Act doesn't actually specify the practitioners from out of state, or doesn't really address it. Now, you will notice back when we were talking about those prescribers who can prescribe, it talks about those licensed under Chapter 458 or licensed under Chapter 459, licensed under Chapter 466. If they're licensed under those chapters, it means they're licensed in Florida. So it doesn't really address those licensed in other states. However, in the Florida Pharmacy Act, the definition of a prescription does include orders from practitioners in other jurisdictions, but only if the pharmacist determines that the order is necessary for the treatment of a chronic or recurrent condition. So based on this, what the law seems to say is that you can take an out-of-state prescription, and this is any out-of-state prescription, but including a controlled substance, only if it's for a chronic or recurring condition. It cannot be to treat an acute condition. I'm not sure how that really works in practice or if it's enforced much, but that's what the law says in Florida under the definition of prescription. So what about practitioners from out of the country? Well, for controlled substances, it's pretty simple. You can't fill controlled substance prescriptions from practitioners from another country because they would not have a DEA registration. Practitioners in other countries are not issued DEA registrations. You got to be licensed in a state in the United States to have a controlled substance DEA registration. Now I know this chapter is talking about controlled substances, but I do want to touch upon non-controlled substances from out of the country here because I get that question a lot, and the answer is not clear. I will tell you, based on that definition of a prescription, it says a prescription from other jurisdictions for a chronic condition is a valid prescription in Florida. So it all depends on how the term other jurisdictions is interpreted. If they mean other jurisdiction means other states, which it probably means, that means you could fill non-controlled substance prescriptions as well from out of state. I think that's probably valid. If other jurisdictions includes other countries, then we could probably extend it to other countries, but I don't think that's the intent. So without a definitive statement that says, yes, you can fill prescriptions from out of the country, my opinion would be that Florida does not recognize prescriptions from out of the country, even for non-controlled substances. Not to say that some pharmacists in Florida, don't fill those prescriptions. I hear stories about people doing that, but that's the way I would interpret it. But unfortunately, it's not really clear until maybe someone goes to the Board of Pharmacy and gets clarification as to what is meant by other jurisdictions. Okay, I want to talk a little bit about telehealth providers. Telehealth is pretty common, especially during the pandemic. It became very common. Telehealth is a recognized practice in Florida, and there are regulations, specific standards on how to do this and record keeping requirements and so forth. The question as to prescriptions issued via a telehealth encounter, are those valid? The basic rules are the same. You have to have a valid doctor-patient relationship in order for those prescriptions to be valid. But since we're talking about controlled substances in this chapter, there are specific rules that say that a prescription based on a telehealth encounter for controlled substances is not valid unless it's one of the following conditions. It's for treatment of a psychiatric condition, it's for treatment of a patient in a hospital for inpatient treatment, or it's for a hospice patient or a patient in a nursing home. So we've got pretty clear-cut rules on controlled substances via telehealth, and they're prohibited except in these 4 situations. I want to touch briefly on who are designated agents. So we're talking about prescriptive authority, but designated agents don't actually have prescriptive authority. A designated agent is a person who is authorized to communicate a prescription, but they can't authorize a new prescription. They can only communicate a prescription that a practitioner has approved already. So this is someone who can call in a prescription, basically. So it's going to be for Schedule 3 through 5 controlled substances, because you can't call in a Schedule 2 prescription except in an emergency. So a practitioner can designate an agent to call in a prescription on their behalf to the pharmacy, and that person could be an employee or a non-employee. They can't call in Schedule 2s, even if it's an emergency. And emergency prescriptions have to be called in directly from the practitioner. DEA took issue a few years back as to who can be an agent of the practitioner, and they were concerned, particularly in a nursing home situation, that the employees at a nursing home that would sometimes takes the order from the physicians would then call in the prescription to the pharmacy that services that nursing home. And DEA said, well, those employees of the nursing home are not employed by the physician who's prescribing the drug, then how do you know that they're an agent? And so what DEA said, even though the regulation says they can be employees or non-employees, what DEA requires now is that if the agent who's calling in the prescription on behalf of the prescriber is not an employee, that you have to have that agency designation in writing from the practitioner. Just something to keep in mind, particularly if you're going to work in a long-term care setting. All right, so that's it for prescriptive authority. We will start again on the bottom of page 90 with mandatory electronic prescriptions in lesson 18.